My name is Abebe Bayih. I am a postdoctoral fellow at the Department of Pathology and Laboratory Sciences in Dr. Dylan Pili Lab. I'm working on malaria. My research area is in testing candidate drugs for malaria. We're trying to test new semi-synthetic molecules as drug candidates for malaria. And I'm also involved in research and diagnostic research in Ethiopia. It's a collaborative research between our lab here at the University of Calgary and University of Gondar in Ethiopia. We're trying to evaluate the new diagnostic techniques for malaria in Ethiopian situation. Yeah, misdiagnosis of malaria is a big problem. I can see a big gap, a big problem in misdiagnosing malaria, especially in developing countries like Ethiopia. Usually, misdiagnosis of malaria is a twofold problem. One, there is overdiagnosis, and on the other hand, there is underdiagnosis. In situations where the physicians primarily depend on the clinical signs and symptoms for diagnosis, there is a tendency of overdiagnosis. So in developing countries, we have not only malaria, but we have other infectious diseases like typhoid fever and visceral leishmaniasis and different viral diseases which have similar clinical signs and symptoms with malaria. So in places where there is no adequate laboratory facility, physicians tend to overdiagnose malaria. And on the other hand, in remote areas, we have very rudimentary laboratory facilities and untrained personnel. So in these situations, there is a tendency of underdiagnosis. They just couldn't diagnose or pick up the parasite in the clinical samples. So we have both problems of overdiagnosis and underdiagnosis. In both cases, the consequence is the same. I mean, it has a deleterious, very huge impact in the management of the disease and in the control of the disease in a certain area. So on one hand, there you have a patient who is misdiagnosed, and as a result, he may not have appropriate treatment for malaria or other infectious disease, or he may be subjected to unnecessary treatment with different antibiotics and antiparasitic drugs. So this is one of the problems of misdiagnosis of malaria. And the other one is, as a result of misdiagnosis, you may have a patient taking inappropriate drugs, and that may result in emergence of drug resistance to parasites like plasmodium or bacteria like typhoid fever bacteria and other parasites. So this is another problem. And the third problem is more of economics. So misdiagnosis of malaria may result in improper treatment. So the patient may not have proper treatment for the specific disease he has. As a result, he skips work. Especially malaria and other infectious diseases occur as epidemics during harvest season and planting seasons. So whenever you have misdiagnosis, the patient skips work. So the family will be in a very big economic problem. In addition to that, the patient is subjected to taking unnecessary drugs. So they spend whatever little money they have on buying those unnecessary drugs. So this puts pressure on the economy of a family, and it has a ripple effect in the economy of the whole country. So the community where you have malaria and other infectious disease will stay locked up in a kind of vicious cycle between disease and poverty. So these are the basic problems of misdiagnosis in malaria and other infectious disease, especially in places where you have multiple co-infections at one time in one patient. Yeah, the potential application of your project, the iGEM project, is really, really huge. I can see a very huge contribution or a very big potential of your project in alleviating the problems of misdiagnosis in malaria and other infectious disease. Because what you're proposing and developing is a machine or a diagnostic technique that can detect multiple infections at one time on the spot. So in places where you have co-infection, let's say malaria and visceral leishmaniasis, the fact that you just diagnose the presence of malaria but not visceral leishmaniasis, or the reverse, would have a very huge contribution in alleviating the problems of misdiagnosis. So it has a very big impact in alleviating these problems. And at the same time, you're using, in your device, you're using amplification step, like isothermal amplification step. This will have a huge impact in increasing the sensitivity of the diagnostic technique. So the fact that you're developing a rapid and point-of-care diagnostic technique for multiple infections at one time will have a very, very tremendous, huge impact on the treatment of the patient and in the control of infectious disease in developing countries in general.